Today at Healthscape, we will talk about one superfood, which is pretty underrated and has got it all to heal an enlarged prostate. Yes, we are talking about saw palmetto. Note that this video is for educational purposes only and does not aim to replace your doctors. Benign prostatic hyperplasia is a non-cancerous enlargement of the prostate gland, often seen in older men. It involves an increase in both the stromal and epithelial cells of the prostate. It's a common condition, with most men showing signs of BPH by the age of 80. BPH typically starts in the prostate's periurethral and transition zones. As men age, their prostate continues to grow, which can lead to enlargement significant enough to press against the urethra. This pressure can restrict urine flow, leading to various urinary symptoms. However, the extent of enlargement and symptoms varies among individuals. Not every man with BPH will experience severe symptoms. The most frequent symptoms include issues like difficulty starting urination, weak urine flow, incomplete bladder emptying urinary retention, and incontinence, as well as increased frequency and urgency of urination, especially at night. A recent review highlighted that the occurrence of symptomatic BPH rises from about 14.8% in men aged 40 to 36.8% in those over 80. However, these figures vary due to differences in how BPH is defined and diagnosed in various studies. With the global increase in the elderly population, the number of men with BPH and related urinary symptoms is expected to rise, significantly impacting their health and healthcare costs. The exact causes of prostate enlargement are not fully understood. Generally, it's believed that dihydrotestosterone, a derivative of testosterone, plays a key role in the growth of the prostate. DHT is formed from testosterone in certain tissues, including the prostate, through the action of the enzyme 5-alpha reductase. It then binds to androgen receptors in the cell nucleus, triggering the activation of genes that promote growth in both the epithelial and stromal cells of the prostate. There are two main treatments for BPH: medication and surgery. Medications have become a standard approach for mild to moderate BPH, especially after clinical studies showed the effectiveness of finasteride, a 5-alpha reductase inhibitor, and terazosin, an alpha blocker, in improving urinary symptoms and increasing urine flow. Further trials have confirmed the benefits of two 5-alpha reductase inhibitors, finasteride and dutasteride, and 5-alpha blockers terazosin, doxazosin, tamsulosin, alfuzosin, and silodosin, all of which have been approved by the FDA for BPH treatment. Alpha blockers work by relaxing the smooth muscles in the prostate and bladder neck, easing urine flow. They are effective quickly, don't change prostate size, and are often the first choice for men with mild to moderate symptoms. 5-alpha reductase inhibitors, on the other hand, block the enzyme that converts testosterone to DHT, helping to prevent further prostate growth. Additionally, saw palmetto extract SPE derived from the fruit of the American dwarf palm tree is also used. Despite some skepticism among doctors about its effectiveness, interest in SPE is growing, particularly as an alternative to alpha blockers and 5-alpha reductase inhibitors, which can have side effects like postural hypotension, retrograde ejaculation, and erection issues. Now coming to the most important part: effect of saw palmetto extract on BPH. Traditionally, Native Americans use saw palmetto fruit for urinary and reproductive issues. In Europe, saw palmetto extract is a common treatment for benign prostatic hyperplasia. There's been a lot of research on SPE for BPH-related lower urinary tract symptoms, but many studies were short and conducted before the creation of reliable symptom scores like the International Prostatic Symptom Score and the International Index of Erectile Function. This review looked at SPE trials that use standardized tools like the IPSS to assess LUTS severity due to BPH. Some observational studies indicated that taking 320 mg of SPE daily for 24 months could improve IPSS and IIEF scores, and life quality and long-term treatment up to 15 years might prevent BPH progression. However, A controlled study showed that 320 mg of SPE daily didn't improve symptoms or urine flow compared to a placebo. Even longer studies, 72 weeks with higher doses, 640 or 960 mg, didn't show improvement in LUTS over a placebo. Thus, currently, it's hard to recommend SPE for BPH treatment. It's important to note that the varying compositions of saw palmetto extract could lead to differences in its effectiveness. The same plant can yield extracts with different levels of active ingredients, affecting their potency. Permixin, a hexane extract of saw palmetto, is one of the most researched and has been found to have a high concentration of free fatty acids, over 80%, which is higher than many other SPE products. This high fatty acid content is linked to its strong ability to inhibit 5-alpha reductase. Clinical studies and a meta-analysis involving permixin have consistently shown improvements in urinary symptoms, including a reduction in nighttime urination and an increase in maximum urinary flow. Its effectiveness is comparable to that of tamsulosin, a common alpha blocker, and 5-alpha reductase inhibitors. These findings suggest that permixin, the hexane extract of saw palmetto, could be an effective long-term treatment for LUTS due to BPH. However, there's a significant variation in the content of active components among different SPE brands, highlighting the need for standardization to ensure consistent effectiveness and recommendations for its use in BPH treatment and prevention. Now, we will explain mechanisms of action of saw palmetto extract. The exact mechanisms of action of SPE are unknown in relieving LUTS associated with BPH. Suggested mechanisms include anti-androgenic, pro-apoptotic, and anti-inflammatory effects. Anti-androgenic effect. The way saw palmetto extract impacts androgen receptor binding has been explored, but this effect isn't very clear. The most researched aspect of SPE is its ability to block both types of 5-alpha reductase enzymes, unlike finasteride, which targets only one type. This enzyme blocking action of SPE has been observed in various cell studies. Clinical trials, like a 3-month study using permixin, a form of SPE, showed that it can lower DHT levels and increase testosterone in the prostate area in men with BPH. This suggests SPE's effectiveness in the body. However, unlike finasteride, which reduces DHT levels in the blood, permixin didn't show the same effect in healthy men. This might mean SPE needs to be used longer or in higher doses to be effective. SPE's impact might also differ in men with or without urinary symptoms, but the exact reasons are not known. Other research indicates that SPE might change how androgens are processed or block their effects. This is seen in animal studies where SPE reduced prostate enlargement caused by androgens. Recent ideas suggest that prostate enlargement might also be linked to inflammation driven by androgens and other factors like inflammatory cytokines. Therefore, SPE's ability to reduce prostate growth might also involve its anti-inflammatory properties. Pro-apoptotic effect. Research has also indicated that saw palmetto extract might help shrink the prostate by promoting cell death, known as apoptosis. In one study, SPE was found to hinder cell growth by blocking the effects of insulin growth factor 1 and increasing the rate of apoptosis in a specific prostate cell line. Additionally, SPE was observed to trigger apoptosis in human prostate cancer cells, including PC3 and LNCAP, through a natural cell death pathway. This effect of SPE wasn't limited to prostate cells. It also induced apoptosis in other cancer cell types, like breast cancer and colon cancer cells. Moreover, in a clinical setting, men with symptomatic BPH who were treated with 320 mg of permixin daily for 3 months showed a significant increase in apoptosis in their prostate tissues compared to those who didn't receive the treatment. These findings suggest that SPE could potentially reduce prostate size by enhancing apoptosis. However, it's important to note that most of these studies were conducted on cancer cell lines, and more research is needed to confirm SPE's effectiveness in living organisms. Anti-inflammatory effect. Recent research has pointed out that inflammation within the prostate plays a role in the development and worsening of benign prostatic hyperplasia. Studies have found that men with prostate inflammation are more likely to experience urinary retention due to BPH. Chronic inflammation in the prostate is linked to larger prostate size, more severe urinary symptoms, and a reduced response to BPH medications. These findings suggest that the anti-inflammatory properties of saw palmetto extract could be helpful in treating BPH symptoms. Studies using permixin, a form of SPE, have shown it can decrease the activity of genes related to inflammation, such as IL-6 and COX-2, in prostate cancer cell lines and primary human prostate cancer cells. In animal models, permixin significantly reduced prostate size and inflammation, showing both physical and molecular changes, like lower levels of certain inflammatory cytokines. Clinically, patients who took 320 mg of permixin daily for 3 months had lower levels of inflammatory markers in their prostate compared to those who took tamsulosin, another BPH medication. Permixin also seemed to reduce certain inflammatory proteins in urine more effectively than tamsulosin. These preclinical and clinical studies indicate that SPE, especially permixin, might relieve BPH symptoms through its anti-inflammatory action. However, since different studies have used various inflammatory markers, the relevance of these markers to BPH needs further validation. It's also necessary to explore whether inflammation leads to BPH and LUTS or vice versa. In addition to its anti-inflammatory effects, SPE's anti-androgenic properties have been widely studied in relation to BPH. SPE is also thought to promote cell death and reduce inflammation, contributing to its potential benefits. However, most of these studies have been conducted in the lab, and their relevance to actual BPH treatment needs clinical validation. SPE might also help relax the muscles of the lower urinary tract, as it has been shown to affect certain receptors involved in muscle contraction, but this area has been less explored in research. Now, what are the bioactive components of saw palmetto extract comprising of? Saw palmetto extract is primarily made up of fatty acids and phytosterols. The saw palmetto fruit itself usually has a high concentration of free fatty acids, about 70 to 90%, including various types such as lauric, oleic, and linoleic acids. However, the specific makeup of SPE can differ across brands. This is due to differences in how the extract is made, where the plant comes from, and any extra ingredients that might be added. Research looking at 14 different SP products available for urinary symptoms found that the amount of total free fatty acids varied, ranging from 40.7% to 80.7%. In a broader study of 57 saw palmetto products from 9 countries, the total fatty acid content in the recommended dose varied greatly, from as low as 8.43 mg to as high as 1473 mg. This study also noted that the levels of free fatty acids and phytosterols varied based on the form of the supplement, whether it was a liquid, powder, dried berry, or tincture. In spite of different levels of total fatty acids found in various SPE products, when it comes to the composition of saw palmetto, it appears quite consistent, as per the research conducted by Booker et al. In 2014. They noted that, regardless of the specific extraction method used, the proportions of 9 distinct individual fatty acids such as capric acid, caprylic acid, lauric acid, myristic acid, palmitic acid, stearic acid, oleic acid, and linoleic acid remained relatively similar across the products. In fact, oleic acid and lauric acid stood out as the major components, making up approximately 30 to 40% of the total fatty acids in saw palmetto fruits. This consistency was observed whether the supplements were in liquid, powder, dried berry, or tincture form, as indicated by Penuganda and Linshield in 2013. Additionally, beta-sitosterol emerged as the most prevalent phytosterol in these products, although its quantity could vary depending on the supplement type. One significant challenge in assessing the effectiveness of SPE lies in the absence of a standardized composition. This lack of consistency may lead to varying results when using SPE for treating BPH. Therefore, establishing a standardized formulation becomes crucial to ensure a consistent and reliable biological impact of SPE. Among the different forms of SPE, permixin, which is the N-hexane lipidosterolic extract of saw palmetto, has been extensively studied. Studies involving permixin have consistently shown positive effects in alleviating lower urinary tract symptoms both in preclinical and clinical settings. Given this, it becomes paramount to pinpoint the major biologically active components within SPE for BPH treatment and develop a standardized formula that reliably promotes better health outcomes. As it stands, only the European Pharmacopoeia has set specific requirements for saw palmetto preparations, stipulating that lauric acid should constitute at least 20% of the total fatty acids, as outlined by Booker et al. In 2014. This standardization effort aims to ensure the consistency and effectiveness of saw palmetto products in improving the health of individuals dealing with BPH. Fatty acids. Fatty acids play a crucial role in saw palmetto extract and have shown potential benefits for addressing benign prostatic hyperplasia. A research by Abe and others in 2009 demonstrated that certain fatty acids found in SPE possess properties that can help alleviate BPH symptoms. These fatty acids exhibit two key actions. They bind to alpha-1 adrenergic receptors, which relaxes muscle tone, and they inhibit 5-alpha reductase, an enzyme responsible for metabolizing testosterone. When researchers fractionated SPE, they found that the free fatty acids within it were primarily responsible for inhibiting 5-alpha reductase. Lauric acid, oleic acid, myristic acid, and palmitic acid, which constitute the saponifiable subfraction, were particularly effective at dose-dependent inhibition of 5-alpha reductase in prostatic epithelium and stroma homogenates. It's worth noting that the inhibitory activity of individual fatty acids can vary across different studies due to different assay systems. For example, lauric acid and myristic acid were highly effective in inhibiting 5-alpha reductase, whereas oleic acid and palmitic acid had minimal inhibitory effects in one study. Lauric acid was found to be active against both isoforms of 5-alpha reductase, while oleic acid and lilinic acid were selective for the type 1 isoform. Moreover, these fatty acids, particularly lauric acid, myristic acid, and oleic acid, showed the ability to inhibit muscle contractions induced by phenylphrin in the rat vas deferens, which is part of the male reproductive system. This action is mediated by alpha-1 adrenergic receptors. While these findings suggest that free fatty acids, including lauric acid, found in SPE can effectively inhibit 5-alpha reductase and alpha-1 adrenergic receptors, it's important to note that most of these inhibitory effects were observed in vitro and their relevance in vivo within the body needs further validation. Additionally, more research is needed to understand the bioavailability of these fatty acids and SPE in prostate tissue. Phytosterols. Phytosterols, although present in relatively small amounts within saw palmetto extract, have shown promise in the treatment of benign prostatic hyperplasia. These compounds are known for their anti-inflammatory properties and their ability to lower cholesterol levels. Specifically, beta-sitosterol, a type of phytosterol, has demonstrated its potential to inhibit the growth of human prostate cancer cells and reduce tumor growth in studies. Clinical trials have further supported the benefits of phytosterols in BPH treatment. In one study, daily treatment with 130 mg of free beta-sitosterol for 6 months led to significant improvements in the International Prostate Symptom Score Quality of Life Index, peak urinary flow rates, and post-void residual urinary volume compared to a placebo. Similar positive outcomes were observed in another study that used a mixture of phytosterols 60 mg beta-sitosterol per day for 6 months in patients with symptomatic BPH. Furthermore, an 18-month follow-up of this trial indicated that the benefits of beta-sitosterol were sustained in patients who continued treatment beyond the initial 6 months. Additionally, a randomized, double-blind study showed that taking phytosterols from pumpkin seeds and saw palmetto for 3 months significantly improved BPH symptoms with no reported side effects.